In this episode, we take a look at Local 1932's hard-fought victory, won earlier this month, to improve the wages and health insurance for some 11,000 San Bernardino County, California public sector workers. And later, we'll hear some labor-friendly music. But first, 93% of Teamsters voted yes on September 9th to ratify a new 4-year contract with the County of San Bernardino. After nearly a year of bargaining, Local 1932 was able to secure a strong contract with significant increases in take-home pay for county workers. The wage increases are based on across-the-board raises, substantial improvements to employer contributions and health insurance premiums, and merit advancement reform that will help members progress through steps in half as much time as before. The centerpiece of the new contract is an overhaul of the long-broken system for employer-provided health insurance managed by the county. Local 1932 will now be able to establish an independent trust fund for members only that will be able to bargain with insurance carriers for quality plans and lower prices, which San Bernardino County was never able to do before. Additionally, the trust fund will finally allow Teamsters the opportunity for pre-Medicare retiree health care coverage. For more, I turn to my colleague Ted Gotch. Ted?
Thanks, Kara. San Bernardino County workers voted in 2015 to join the Teamsters. And though the public workers contract was still years away from expiring, the union got to work trying to improve the lives of its members. Local 1932 Secretary-Treasurer Randy Korgan said it spent 2 years preparing for negotiations and another 10 months bargaining. All that time was needed given the more than 800 worker classifications represented by the Teamsters. It quickly became apparent that improving members' health insurance was a top priority.
So what Local 1932 did was, when we put the surveys out roughly 2 years ago, is and amazingly, more than 7,000 surveys came back. So you obviously had a very large percentage of people participate in what the issues were. What floated to the top was affordable health care and how much their health care costs were affecting them. You had a lot of families that were paying $600 to $800 a month out of their pocket to pay for the health care. In addition to not making a lot of money. Public employees, I know they're villainized as being millionaires and making all kinds of money and having all these free benefits. But the reality is that's not so much the case anymore. That stuff has been gutted, and there's some economic struggles for people. Well, we didn't just deal with the economic struggles. We also dealt with the contractual issues and the daily grind of operations where people are working. And so in the surveys themselves, what came out were literally hundreds, if not thousands, of issues surrounding their workplace and their employment. And as far as the affordable health care issue is concerned, we had identified that thousands of county employees were on some sort of subsidy, some sort of government subsidy for their health care. Their children were on Medi-Cal or the Affordable Care Act or other subsidized groups. A lot of employees couldn't afford to put their spouse on the plan as a result. And so here you had a government entity depending on another government entity to provide health care benefits. And the more we researched that over the last couple of years, the more we found that those numbers were alarmingly high. They were significantly high. Matter of fact, we sent a letter to the county and asked them how many of their employees were on some sort of subsidy, and their response, their answer was less than 100. And we were shocked by that because clearly they didn't understand the totality of those healthcare costs for these employees, for their employees. And that's why we kind of put it front and center as a really important message for the overall campaign.
Shelly Swanson, a 11-year employee at the San Bernardino County Workforce Development Agency, said healthcare insurance costs were leaving her family in a real bind under the old contract.
Out of each of my paychecks, I have to contribute $350 on top of what the county gives me out of each of my paychecks to cover my children's medical insurance. So my position essentially requires a master's degree and my income is low enough that my kids get free lunch, that they qualify for Medi-Cal, and I know I'm on a higher level of staff, so it's got to be at least half the staff of the county qualify for earned income credit, food stamps, Medi-Cal, because the insurance is ridiculous, and the county is one of its worst enemies because they're not paying enough to get their own employees out of the system that we support. It's disheartening that I do what I can for the public, I do what I can for my children, and I do what I can for my family, and I can't seem to dig out of the hole. And as a single parent, it's even worse. Had I not have the support of a huge family and a very supportive family, I don't know where I'd be. To rent a house for 3 children, even a small 2-bedroom house, I cannot make ends meet. And to have even the $1,000 more a month or the $750 more that they take out of my check for medical insurance would make a huge difference in just the size and location of house I could rent, to raise my kids.
Meanwhile, Rosa Garcia, an eligibility worker with the county's Transition Assistance Department, worried how she and her co-workers would be able to afford their insurance when they retired and aged.
We're expecting that one day when we do retire, that we're going to be afforded the ability to retire comfortably. And it's not something that I foresee is going to happen. And I think that's why a lot of people don't retire, because it's something that once they find out how much they have to pay for the unaffordable insurance that is offered by the county, it's something that keeps them working until they become 65. I've seen some people that are here and they're 68, 70 years old because they can't afford the insurance. The last 6 years, as an employment service specialist, I've been doing a job that I love to do. I like inspiring people, motivating them. And then, of course, when they come back and tell you their stories, and they do come back and they say thank you, and I tell them, no, it was you that did the job. I just, kind of showed you the way. And so, you inspire the people because you want them to be successful. You want them to have a good job. And you want them to someday have a retirement. But then at the end, when it's close to retirement, you find out your retirement for your medical is not that good. $1,032 a month, that's ridiculous. I don't know who could afford that. I'm going to have to go either through California Choice, or I'm going to have to just go without insurance and forego it because I'm not going to be able to afford that type of insurance. It's something that the county really has to work on. It makes you lose sleep at night sometimes, just thinking, how are you going to figure things out? Because you got to figure it out. And the county isn't worried about it. It doesn't seem like they're very concerned about how we're going to make ends meet at the very end.
Local 1932 began ramping up its efforts in early 2019, taking its lobbying to the San Bernardino County Board of Supervisors, to other elected officials, and even to their job sites. They wanted elected officials and the public to understand what was at stake, Korgan said.
The members themselves, the bargaining committee, and shop stewards throughout the system were, as time went on and the campaign started to increase, they became more and more active, more and more involved, and really carried the message of affordable health care from their voice, not just from the union's voice. We always say in the union that the union's only as strong as its membership, and that the union's not the institution of some individuals. The union is a collective body of people. And at the end of the day, this was a true example of that coming out. The international, the joint council, the division, all the local unions, everybody chipped in to help this effort. And for the County Board of Supervisors and the administrative individuals at the county, they recognized the support behind this sort of campaign, and the support behind a message like this. And let me take it a step further. The community as a whole was supportive of these members. We had letters of support from community organizations, from elected individuals, most of them which we didn't use because we had settled the contract as we were laying these out. And these organizations or elected leaders, congressional, congressmen, congresswomen, state assembly, state senate, mayors, city councils, all these leaders, elected leaders in the area, were sending in letters to the Board of Supervisors and the CEO of the county, just saying, hey, we were unaware that the health care costs for these employees were so high. We support the effort to try to bring those costs down. And as a result, the community rose up and assisted. So these events that we had, and holding these large-scale events, as well as the actions that the members did, they started doing actions at work where they would take their lunch in the parking lot. Collectively, everybody would come out at the same time, take their lunch in the parking lot, and show solidarity and wear their affordable health care shirts and have their signs and put the signs in their window. And it just really sent a message throughout the entire workplace that this was the priority issue, and we're really proud of how everybody kind of came together to make that happen. It wasn't easy. Look, we were in bargaining starting in October. We started to press the issue for more affordable health care in April, and we really didn't get the county to move on starting to commit more money into helping offset the cost for health care until probably July, sometime in July. And that, once the pressure started to be applied, and I think once people started to become active, I think that the county realized at that point that this was like real. It wasn't like some, smoke and mirrors. It was really a righteous issue that a lot of people were being negatively affected by these costs. And when you see a large group of people making under $20 an hour that are having to pay $600 to $800 a month for their health care, that is just extremely difficult for those families and how they can pay that. And it's a difference between paying their utility bill on time or paying their mortgage or their rent or their lifestyle. So, no, I don't think that Board of Supervisors were easy at first. I do appreciate that they came around, and I think that they did listen as we met with them individually and talked to them, explained to them ideas that could be that they could utilize. They listened to our criticism of how they've been handling the health care for some time, and then ultimately we got to a point where it looks like there's some good dialogue on the subject.
These actions built momentum and resulted in success. Finally, in the early hours of August 22nd, Local 1932 and the county were able to come to a full tentative agreement. In the end, Local 1932 was able to announce no takeaways and at least a 20% increase in total take-home pay for a majority of Teamsters, and many contract improvements as well. On September 9th, Local 1932 ratified the contract after a vote by the membership. The Board of Supervisors approved the agreement the next morning. Member power, Teamster power, won affordable health care, a pathway to retiree medical coverage, and a better life at work for county workers. It was a hard-fought victory, but one that Korgan said was well worth the effort.
It's a tremendous feeling to be part of a process that was such a game changer for people. When members call you and send letters in of deep appreciation on how transformative this contract will be, it's such a game changer for people's families. We have this contract there are people that we have that are making $17, $18 an hour that will be getting a $5 an hour increase in 3 years. It's not 5 exactly, but it's like $5.20 or depending on what bracket you're in. So many of the things were improved in the steps, accelerating how long it took to get people to top scale. It took 14 years. That was cut down to 7, so people will accelerate through their steps twice as fast, as well as there were increases, regular across-the-board increases when you add those together on top of one another. And then the game changer of the health care immediately upon ratification, they're paying significantly less for their health care and a couple $100 a month going in their pocket immediately. And so you add all those things up and you've got $600, $700, $800, $900 a month. Those members are coming out now and saying, wow, we're so appreciative of this process, and some of them are very emotional about it, and we're very proud of that work. Yes, it was a lot of work. It was very exhausting, doing the trainings, the development of the bargaining committee, stepping through, having more than 30 bargaining sessions, and then getting to the point of a result that is 93% accepted what in this country gets accepted by 93%? Like, even, we all know that, we're in a time of some divisiveness, and some people will always argue about anything, but a contract that's accepted by 93% tells us we're in a pretty good position. And the members themselves are appreciative of that process, and that's our education of that process, and getting them to respect that process goes a step further into helping us organize the community, helping us organize non-union workplaces, and saying, hey, if you appreciate this as much as you do, let's share it with our friends and neighbors and our family members, and let's encourage them to organize so our union can grow, because our power will come from our membership's growth. And that's what's been great to see, is how people have been really embracing that next step.